This is Chapter 18, Impact of Cognitive and Sensory Impairment, Part 2. And we were just talking about hearing impairment. And so here's a girl with a hearing aid that's kind of attached down here. She also has an eye patch for amblyopia. So, manifestations of hearing impairment in infancy. A baby who doesn't hear isn't going to have that startle reflex to a noise. They're not going to babble, and usually if they're not babbling by 7 months, we need to get them referred. They're just going to have general indifference to sound. When sound's around them, they don't respond to it. They don't respond to being spoken to. So the treatment, if it's conductive, we're going to treat whatever the problem is. Antibiotics or ear tubes as needed for otitis media. If it's permanent, then we're going to use hearing aids. Hearing aids amplify sound. They make it louder. And they say the absence of well-formed syllables, so this is ma, ma, ba, ba, da, da. If they don't have that by 11 months, that should be an immediate referral. Babbling by 7 months should get a referral. If that got missed, then no syllables by 11 months should get a referral. On sensory neuro loss, hearing aids really don't work because they make the sound louder, but the issue is not the sound coming into the middle ear. It's where it changes from vibration in the middle ear bones to nerve impulses, and so just making it louder doesn't necessarily do very much. Cochlear implants are a way to do this. So they bypass the cells in the cochlea to directly stimulate what auditory nerves there are. And there's some really cute videos on YouTube, if you've never watched them, of a child hearing their parent for the first time, a child who's had a cochlear implant. And here's just sort of a picture of what it is. So this is the cochlea, this little curly part, it's the middle ear that's full of little hair fibers that then send the stimulation up the nerves. So basically we bypassed that and stimulate the nerves without needing to use the middle or inner ear here at all. Cochlear implants. Parents who are hearing, who have a child who's hearing impaired, are most likely to opt for a cochlear implant if it will help their child hear. Parents who are deaf often are quite resistant and don't see a need for this. They feel like not hearing is just a difference, but not necessarily something that needs to be changed in that child. So, visual impairment. This is a visual loss that cannot be corrected with regular prescriptive lenses. Near vision is usually better than distance for just about all of these kids. And legally blind, this means visual acuity of 2200. So what you see at 20 feet, the average person can see at 200 feet. So that's how that works. That 2040 means you can see it you have to be 20 feet away to be able to see it, where the average person could see it when they're 40 feet away. So some causes of visual impairment. Myopia. This means nearsightedness, which means you can see things that are close, but not far. So this is fixed usually with glasses, corrective lenses. Hyperopia is farsightedness. You're able to see things far away, but not things that are close. Again, usually lenses. Occasionally they'll do surgery for either of these. Eye trauma. This is a common cause of blindness in children. They get, something impales the eye and the eye does not work anymore. Astigmatism. This is the cornea covering the eye. It has some weird bends to it. It's not equal. And so it's like looking in one of those funny mirrors where things are bent and curved funny. And we can fix this with glasses, corrective lenses. Amblyopia is lazy eye. And the problem is, with this, one eye has a better vision than the other, significantly better, or they're picking up two different images because they're misaligned. Either way, the brain does not like that. The brain will use the good eye or the one image, and the other eye will get worse and worse and worse till the brain quits using it. Once you let that happen, you really can never get that eye back. So what we do is we patch one eye, the good eye, to make the child use the weaker eye, to strengthen that weaker eye, to make the brain pick up the image from that weaker eye. And depending on how severe it is or what's going on, the patching can be anywhere from just a few hours a day to just about their entire waking time. Strabismus means you have misalignment of the eyes. They can be misaligned kind of up and down, which a child usually will tilt their head or squint. They can be crossed or outward deviated. Again, our concern is this will lead to amblyopia, where one of the eyes the brain quits using the image from that eye since the two images don't match. So we're going to patch one. Sometimes they'll need to do surgery to change how those muscles are pulling. And then cataracts. Infants are occasionally born with cataracts. So this is an opaque lens. You can't see through it. That lens has to be taken out. And a new one put in. The problem is we really don't want to put it in an infant because they're going to grow and change. So they will take the lens out, wear very thick glasses until they've grown a bit, and then they'll put new lenses in. So eye emergencies. If you get a foreign object in the eye, tell the child not to rub it, and if you can, remove it. Use the end of a tissue or a damp tissue. A chemical burn, so something irritating gets into the eye. It should be irrigated with tap water to get it out. You can irrigate eyes for up to 20 minutes, depending on what the substance in there is and how corrosive it is, because we want to get it all out. Sunburn of the eyes. If they get burnt, you want to patch them and have the child just rest with their eyes closed. But make sure when you put those patches on that the eyes are closed underneath the patches. Hematoma, this is a black eye. Treat it with ice for the first 24 hours. You may want to get it checked to make sure that there is no trauma other than just the bruising around the eye, that there's not actual trauma in the eye that needs to be taken care of. A penetrating injury, something poked into the eyeball itself. Go to the emergency department. Do not remove the object. Go to the emergency department. Children who are deaf and blind, this has a profound effect on their development. They probably can achieve the motor milestones, although with the blindness, they're going to be a bit clumsy and fall and bump into things, right? But their other developmental milestones are going to be delayed. These kids, we can do things like finger spelling, so they're learning sign language, but they have to feel it. They can't see it. And developing goals for this child need to be realistic. And, we're going to do as much as we can to get them as functioning as highly as possible. Autism. This is a complex developmental disorder of brain function. Has a broad range of severity and usually impacts intellectual functioning, and they have behavioral deficits. It has to manifest between 24 and 48 months. If it's older than that, we're not going to call it autism. We are now saying it occurs in 1 in 68 children. It's 4 times more common in boys. And we don't really know what causes autism spectrum disorders. There's some theories that it's a combined genetic, hereditary thing, and then a medical issue kind of triggers it. We do know it runs in families, that hereditary, which makes us think there's some genetics to it, but no specific gene has been identified. So they think there may be like some sort of immune response or environmental factor that triggers it. So an environmental or a viral infection happens to somebody who's susceptible, then that triggers it. But we really don't know. We do know if you have one child with autism, you're more likely to have another. So it does run in families, and it's been quite thoroughly studied, and no evidence that immunizations have anything to do with autism. It typically is really noticed and diagnosed around 18 months, which is when you get the MMR vaccine, but it's been studied and they cannot find any relationship to that. The thought was it may be the marisol, which is a preservative that has a little bit of mercury. So the thought was, is this mercury poisoning? Again, the marisol was taken out in the 90s and the incidence has continued to climb, even though kids are not being exposed to that anymore. So that doesn't help us to know what it is, but we are pretty certain it's not immunizations. So how do we diagnose this? Well, this child has deficits in social interactions, communication, and behavior. They have some bizarre behaviors. Poor or abnormal eye contact. They do repetitive behaviors. This is called perseveration. So they may, take their little truck and just roll it back and forth and back and forth and back and forth. So repetitive behaviors that normally a child without autism would get bored and not do this. They tend to have very limited interests, and sometimes they're bizarre things, like they love washing machines, and they learn about every washing machine and every brand, and they don't have good social interactions, or they don't pick up on social clues. So the kid who loves washing machines will go up to strangers and tell them, did you know the Maytag makes blah, 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 and they just spout off stats about washing machines, even though the person's looking at them with this shocked and concerned look. They don't pick up on that look at all. So limited interests and or activities, and that's foods too. They tend to have a very limited diet. They do self-stimulation behaviors, that's rocking or head banging or flapping their hands. They do a lot of that. And then most have some amount or some cognitive impairment, can be from mild to severe. So nursing considerations. These kids do better with a structured environment, a consistent routine, and a behavior modification plan. So they know if they do this, this will happen. If they do that, that will happen. In the hospital, we really want parents to stay as much as possible because the parents know the kids. Every kid with autism is different. Usually, it's helpful to decrease the stimulation. They may not like holding and touching and eye contact, so minimize that. They're often very fussy eaters, have limited diet of what they will take. They are very slow to warm up to new situations, so introduce new things slowly. They have communication issues, and they do not understand complex, abstract communication. So keep your communication brief and concrete. And then family support. Be sure we're supporting the family. Raising children is hard. Raising a child with special needs is harder.